The birth control pill can change who we're attracted to, who we'll choose as a mate. And folks on the pill would choose a different person than off the pill. The birth control pill can actually change your brain. It can change how you think, how you feel, what choices you'll make. We do see a link between inflammation and cancer, inflammation and cardiovascular disease, along with mental health issues. Ovarian aging is accelerating at a faster rate than what we are really comfortable with. Today, we're diving into a topic that has become near and dear to my heart. We're going to be talking about birth control, and is it safe? Is it not safe? And what are the long-term risks of being on birth control for long periods of time? Okay, before we jump in, quick health check. Are you subscribed yet? You'd be surprised how many people forget the one click that actually helps them feel better every week. Go ahead, hit it. Around here, we turn science into self-care you can actually use. Let's get started. I continue to meet women over and over again who've been on the birth control pill for 10 years, 15 years. In fact, they use the birth control pill from the time they were teenagers to regulate their hormones and regulate their cycles. And they've never had an opportunity to dig deep and understand what's going on with their different hormone levels. Part of why I'm so interested in this selfishly is, of course, we've had patients over the years ask us these questions about the birth control pill and what I think and what we need to do. But I do have an 18-year-old headed off to college, and I want to be prepared for her and for her friends to really talk in a holistic manner about what it means to be on birth control. Because we know you need birth control, but there's got to be an in-depth look at what it really means for our bodies. Now, the research coming out around the birth control pill and the impact on our health is evolving. And daily, I'm seeing a new study, something new talking about how we need to be thinking about birth control and birth control usage a little bit differently. But I think one of the things we've known for a very long period of time, this is not new research, this has been there, we're just not talking about it, is the connection between birth control and inflammation. And let me talk to you a little bit about what I mean here. What we are finding in research over and over again is that there is a link between low-grade chronic inflammation and being on the birth control pill or even an IUD. Now, somebody listening to this may push back a little bit and say, well, women have inflammation at varying points of their cycle anyways. And you are absolutely correct. The nature of our hormone and our hormone rhythms really lends itself to having issues with inflammation. And here's why. Anytime we shift our hormone cycle, when progesterone levels go down as they do towards the latter half of the cycle, or if we have higher than average levels of estrogen, that ratio, that estrogen to progesterone ratio, when it's not in the right place, can be a trigger for chronic inflammation. But here's what's different when we bring the birth control pill into the picture. When we go to measure inflammation in women at varying points of their cycle, and in our young girls, by the way, yes, we can find elevated levels of maybe a CRP, which is a marker of inflammation, a SED rate, or something called IL-6, interleukin 6. Interleukin 6 is an inflammatory marker that we don't use frequently, but it is a better in-depth look at low-grade chronic inflammation, as is your white count. Just looking at your WBC or your white blood cell count can be very helpful in understanding where you are with inflammation. So we've got these issues with inflammation when it comes to women and hormones, which is also why women are more susceptible to autoimmune disease. But when we add in the birth control pill or an IUD, that inflammation picture changes a little bit. Instead of just being elevated CRPs or a high IL-6, we actually see elevations in a different kind of inflammation marker. That one is called TNF alpha or tumor necrosis factor alpha. And that one is tied more to mood and to weight than a traditional IL-6. So what does this mean for young women and girls and even women in perimenopause who are managing their symptoms with birth control, maybe birth control pills or an IUD? Well, it means that we do need to be tracking inflammation in a more strategic and a consistent way. Because the downside of this, or sort of if we fast forward, is that we do see a link between inflammation and cancer, inflammation and cardiovascular disease, and definitely inflammation and metabolic disorders, along with mental health issues. So, if women are already vulnerable on the front end of this, before a birth control option even enters the picture, then we become even more vulnerable when we start engaging in different forms of birth control. Now, I know a lot of you are going to push back and say, oh my gosh, the birth control pill stops my pain. It controlled my endometriosis. It helped with my bloating, or so many other things that the birth control pill or birth control in general can actually do. I know that something like an IUD has stopped super heavy bleeding. Those things are the benefits, right, of understanding or being able to use some of these different methods of contraception. However, what we have to look at is weighing the pros against the cons, right? So if you do have horrific periods and they aren't being controlled by some of the things we're going to talk about later in the show, then yes, a birth control pill or an IUD is absolutely an option. Or if you really need contraception, then yes, these are options. But what we're asking for, or what I'm asking for from a holistic standpoint or a whole body standpoint, is that we actually monitor some of the downside or some of the side effects that we know of birth control. So, inflammation is one of them. And looking at something like a TNF alpha, your white blood cell count, looking at IL-6, and then the more traditional sort of ways of checking inflammation, which include a CRP and a SED rate, are helpful as well. Now, the IUD, some of you may say, okay, I'm not going to do the birth control pill. I'm going to do like an IUD, a copper IUD or a non-hormonal IUD. That actually contributes to inflammation in a slightly different way. What studies are telling us, I'm looking at this right now as we speak, is that copper IUD folks actually experience more issues with bacterial diversity, meaning their microbiome isn't as balanced as someone not on the IUD. And the reason for this is because it causes an inflammatory reaction, resulting in a shift towards an anaerobic profile of bacteria versus having the right amount of lactobacillus bacteria and bifidobacteria in your gut that you need to help mitigate inflammation. So again, whether it's birth control pill or whether it's your IUD, both of them may be contributing to this inflammatory response. So again, screening, checking, understanding where your gut health fits into the conversation around birth control, understanding the link between the gut, inflammation, and birth control, and then making a choice is probably your best bet. Now, when it comes to choosing an actual birth control option, let's go through some of what the current options are, as we speak. So we definitely have the pills. So we have the monophasic pills, which means there's just a fixed amount of hormone coming into your system, right? These, like all the other pills, suppress ovulation, they thicken your cervical mucus and your uterine lining. They affect the liver, something called the sex hormone binding globulin, which impacts how much hormone is circulating around, bound or unbound, your nutrient loads, and then, of course, the inflammation markers that we just talked about. So the monophasic pills mean same dose all throughout the month. These are things like Yasmin, Sprintec is one, Junel, low estrogen, low estrogen, microgestin. Those are examples of your monophasic pills. Your multiphasic pills will vary throughout the month. There's some variability in the dosing. So orthotricycline is one that's very common. Npress is another one. And then you have your extended continuous cycle pills, which means that they're sort of maybe going over the course of 3 cycles or 4 cycles. Those are things like Seasonique, Amethyst, Revelsa is another one. We have our patches, which are Xulane. Twirla is another example of that. And then, of course, we have our vaginal rings like the Nuva ring, or a newer one called the Anovera, which is actually a 1-year ring. So when we have these combined, and by the way, these are all estrogen and progesterone combined options, right? They're not progesterone alone or progestin alone, but they're combined. So when we've got some of these combined hormones, Some of the concerns are we see an elevation again, as we talked about, in TNF alpha and CRP, your inflammation markers. We see an increase in something called SHBG, which is your sex hormone binding globulin. We check these routinely at Whole Plus, but that in turn is impacting testosterone levels and can in turn bring your free testosterone down, which is going to affect your mood, your libido, and your overall metabolic health. In addition to that, these combined sort of hormone regimens will impact nutrient and nutrient loading. I want to pause here because I see this pattern all the time. People are doing the research, they're listening to the podcast, they're trying to take better care of themselves, and they still feel so stuck, especially when it comes to their health, their hormones, their stress, and even taking care of their families. That's why I created The Circle. The Circle is my private membership where we go deeper into these topics with real guidance, demos, live sessions, and a supportive community. If you want to try it, there's a 1-month trial available right now. You can learn more at wholeplus.co/circle. That's HOLPLUS.co/circle, or just click the link in the description below and use the code YouTube. Now let's continue the conversation. We know, and we see this in research, that the birth control pill and some of these hormonal options will impact your load of B vitamins, magnesium, zinc, and selenium, which, if we tie all those nutrients to so many different other processes in the body, we understand that that in turn is affecting your thyroid, your insulin, your ability to build muscle, your energy, your focus and concentration, and so much more. We also know that this impacts glucose and the way your body uses blood sugar and glucose and insulin. And then lastly, it suppresses something called the AMH, which is a very important marker to talk about. But when you test an AMH for somebody that is on birth control of some kind, it's going to test out low because you're artificially suppressing their ovarian reserve. So again, these are some of the things we need to be thinking about. I'm not trying to pin birth control as being bad, but just saying we need to be thinking about some of this stuff as we move forward. Now, there are progestin only options for birth control. These thicken up the cervical mucus and they suppress ovulation depending on the formulation. Now, some folks don't metabolize progestin very well. So these are the patients that I see that will often have a lot of breast tenderness with the progestin only sort of option, or they'll start to gain a lot of weight. Your hormonal IUDs are an example of this, like the Mirena, Kylena. These are some that Skyla is another one that are progestin only. Your subdermal implants, like your Nexplanon, is another one. And then, of course, we have the injectable options, which are a little bit older, like a Depo-Provera or a Depo Sub-Q, which again are progesterone only. So the issue with progestin only is there are some concerns around bone loss, again, around lowering testosterone. And remember, progestin is an androgen. So if you're someone already dealing with high androgen symptoms like hair loss and acne and oily skin and some of those type of things, then a progestin only solution may not be right for you because there is an androgenic component to that. So again, we have to think through if you're somebody with PCOS, or now called PMOS, and you're having those particular issues and you start, a progestin only form of contraception, well, then we may be increasing your androgenic load and there's the potential to have more issues with some of those high androgen symptoms. So what's the answer? The answer is, if that is the option you choose, then we need to track and we need to test what's going on there. All right, aside from the combination of estrogen and progesterone to progestin only, there are also non-hormonal versions of contraception. These include, again, the copper IUD, which is the Paragard, barrier devices like the condom, spermicide gels, diaphragmatic caps, and again, natural cycles, right? Where you are aware of your fertility window, you are tracking it, you know when ovulation occurs. On a traditional 28-day cycle, most for most, and everyone's different. This is why you have to check. Ovulation is usually somewhere between days 12 to 14 or so, and that way you can track and see sort of what's going on there. And of course, there's the permanent options like tubal ligation, and of course, having your partner get a vasectomy. So, bottom line, we've got many different options on the menu when it comes to contraception. But the nuances there are understanding what your body may need and what it may do better with, and then what needs to be tracked as we move forward. Everything from inflammation to nutrient load to your androgen index to testosterone to even the markers of your mental health. Now, let's revisit the nutrient component for just a minute. And this is where I think we really get women into trouble because we put them on any of these things, but we don't do nutrient testing. We don't talk about or do any kind of nutrition counseling with them, right? Whereas we know or we have the evidence, so to speak, that many of these forms of contraception, like I said, drop B vitamin loads, magnesium loads, zinc, selenium, and even CoQ10. So, what does this mean for you? So, when B vitamins are falling, and if you've been listening or following me for a while, I talk a lot about like these bookends, right, of hormone and hormone health that are B vitamins sort of in the morning and magnesium at night. B's, of course, helping with the mitochondria, helping with energy, magnesium helping with cortisol and sleep, and even hormones like progesterone and thyroid. But as we deplete these hormones, women and girls start to experience more issues with anxiety, with focus and concentration, sleep disruption for sure, and then a lot of issues with their stress response. So, this is why we say that the birth control pill can actually change your brain. It can change how you think, how you feel, what choices you'll make, and even your ability and bandwidth to take on risk and to try new challenges. Now, that's pretty profound because if you're a young woman, maybe anywhere from 16 to 25 or even 30, and you're on a form of contraception and you're stuck at a place in your life where you're not sure what the next step is, just realize that your contraception could be influencing your decision making. And I had on a researcher, I think it was about a season or two ago, Dr. Sarah Hill. You guys could probably look that episode back up. But she talked very clearly about how, the birth control pill can change who we're attracted to, who we'll choose as a mate. And folks on the pill would choose a different person than off the pill. And it was very fascinating research. But at the end of the day, I think the take home message and what we know even from the nutrient component of this is that the birth control pill can indeed change your brain. So it's important to do nutrient testing alongside whatever you're choosing from a contraception standpoint. So let's get into what we can do, right? I don't want to be all doom and gloom. Got to tell my daughter something, got to tell her friends something. What can you do to kind of take advantage of choosing the right contraception and understanding that the emerging research is advising you to do two things in particular. One, to choose wisely, and two, to not assume you should be on birth control, A, for control of your hormones, and B, just to be on it for extended periods of time without really digging in to how it's impacting your overall health. So, first things first, here's what I want to do. We can't get away from this. Please don't roll your eyes, but you cannot get away from the importance of a healthy diet, even when you're choosing a birth control pill, especially if you understand and adhere to the premise that as a young girl or a woman, we are more prone to inflammation anyways. So, an anti inflammatory diet, minimizing processed foods and junk foods, minimizing alcohol, high sugar, and high yeast foods is critical. We want to keep alcohol maybe under about 4 to 6 drinks a week. And if you are going to drink more than that, college kids, high school kids that should not be drinking, and everybody else older than that, then you do need to have a plan to minimize inflammation post one of those episodes. Whether that is going on a 3-day cleanup, doing things like glutathione or NAD to help mitigate that inflammation, but you have to be thinking about this. So, an anti inflammatory diet, reducing processed foods, critical even as a starting step to contraception. Next, start to support your nutrients. You can do this in two ways. You can nutrient test, where you can come into one of our clinics and start to understand what the levels are of B vitamins, magnesium, zinc, selenium, CoQ10. Or you can start to do some supplementation, at least with a B and magnesium, to help those bookends of healthy hormones and healthy hormone balance that in turn help your brain, help your mood, help your energy, and help your metabolism as well. So, those are some of the ways to get started in this conversation. If you are ready for deeper testing, here are the things, if you want to write them down, that I would recommend that you check before you choose a method of contraception. Look at your pre-birth control, pre-contraception AMH levels. Understand where your ovarian reserve is before we start to tamper with it. Understand where all the B vitamins are: magnesium, zinc, copper, vitamin D, your inflammation markers like a CRP, TNF alpha, and even an IL-6, and a free testosterone and sex hormone binding globulin, along with a fasting glucose and fasting insulin level. These are all critical to understanding where you are versus your best friend versus somebody else you know in your family in terms of where you need to land with your overall nutrient profile. Next, I would say really start to look at sleep and stress, because those will directly impact what your levels of hormones are, what your ovarian reserve will do, and where you will land in this conversation. Chinese medicine talks a lot about qi, or energy that we're gifted with, right? And one of the things they talk about is when you apply that concept of chi to even something like ovarian reserve, right, which is a sign, they say, of your kidney chi, then it is your responsibility to preserve and protect it. Or are you going to drain it rapidly and in turn accelerate something like ovarian aging, impacting your fertility in the years to come? So, again, these are things that you have to be conscious of. If you have a rough week or exams or something that has kept you up and prevented you from sleeping, well, then we have to do the recovery work, which is where your self-care doubles or even triples, whether that is acupuncture or massage or getting out in nature or getting morning sunlight. All of these things are resetting that cortisol axis so that you in turn won't fall victim to cortisol and hormone disruption and inflammation down the road. We can't have a conversation around birth control without bringing in kind of the East-West Chinese medicine, Ayurvedic medicine perspective. They approached this concept or this topic by saying women needed to supplement their chi or their energy or their life force. And their toolbox usually turned to herbal medicine and herbal remedies. These were in Chinese medicine rooted in something called kidney jing. That's how they talked about it, which was directly tied to reproductive vitality. Jing, they said, could be depleted by stress, by overwork, by years of suppressing the natural cycle. Downstream is what we call ovarian aging in Western medicine. So here are some of the herbs. Again, I don't want you just to run out and start these. You have to ideally, do it with some advice. But Dong Quai is one that we talk about all the time. It supports estrogen balance. It's an anti-inflammatory herb. Bai Shao is another one. Again, nourishes the blood, helps with the LH and FSH ratios, really does help to reduce PCOS symptoms. There's Romania, which is again a kidney tonic. It improves AMH as well. Dongshen is one that we've used before. It's a qi tonic. It supports the gut. So all of these are some of the traditional Chinese medicine herbs that were in their formulary to improve this idea of kidney jing. Because again, it was about providing energy and then moving energy. So you provide energy with food and rest and herbs, and you move energy with acupuncture, moxibustion, or cupping. Now, in Ayurvedic medicine, very similar idea, very similar concept, except they used different words. They talked more about something called ohas and pranas, prana being your energy, ohas being sort of your dosha or where you landed. They also turned to herbs, although the herbs were a little bit different. They talked about shathvari, which was sort of the queen of herb or the queen bee herb, I should say, for reproduction and for vitality. It was a reproductive tonic. It helped the hypothalamic pituitary axis and helped follicular maturation. So that was a big one. The other one was ashwagandha, which you guys have all heard before, but helps with stress resilience, helps the HPA axis for sure, helps with cortisol. And then amla, which I personally love and is in a lot of my formulas, which is an antioxidant, supports the immune system, nourishes the tissue, really high in vitamin C, and supports kind of egg quality and oxidative stress. So shathvari, ashwagandha, amla, another one called tribulus. These were all herbs used in the Ayurvedic toolbox when it came to protecting reproductive health. So long story short, what do you do when you're thinking about birth control, and what do you do when you're thinking about how to use contraception effectively? The pill should be a helper. It shouldn't be something that's sabotaging your overall health. And the way to move forward and do this is to, of course, put the fundamental pillars of holistic health into place, right? Diet, sleep, stress management, herbal remedies. But more importantly, understand where your starting point may be. Where's your nutrient load? Where's your gut health? Where's inflammation? Where's your AMH? Where are you in the conversation around ovarian aging? And I'm actually reaching out to everyone 12 years old and above. Because in the environment that we live in today, we understand that ovarian aging is accelerating at a faster rate than what we are really comfortable with. And women, when they hit 25, 26, and 27, are having to make choices and decisions, not just about their hormone health, but also about fertility that may not serve them well as they move into their 40s, 50s, and beyond. So, this is a conversation for all women, for moms like me with young daughters, for teenagers that want to get educated, and to understand that birth control exists and may be necessary for a season of your life, but it should be short term, well thought through, with a full understanding of your personal chemistry and your overall health. All right, that is the holistic approach to birth control and thinking through it. I could probably go on forever and talk more about Ayurveda and Chinese medicine and so many other thoughts there. But I wanted you guys to at least have a starting point, or at least start to stir something in your brain if you have never thought about this before. Remember, the future of your health is holistic, where you put all the pieces together. You take the time and energy to wind your story into a beautiful sort of roadmap that you can follow no matter how old you are and no matter the twists and turns that your life has to offer you. All right. I hope you enjoyed this episode of the show. Don't forget, we post new episodes every week. Please subscribe and share this with a woman who needs to hear this if they are thinking about a birth control or hormone journey in their future. I'll see you guys next time. Before you go, remember, healing doesn't happen all at once. It happens in moments. If today's episode gave you one of those moments, subscribe and keep learning with me. The next video is right here, and it picks up right where this one left off.